Okay, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment. You can see our shaver coming in here. And back in the posterior horn there, you can see the tear. Like we talked about, we'll have to see if this is repairable. If it is, we will. We'll take a probe in just a minute here and have a good look. So here we're looking here. There's the split. And you can see it extends back here to the right, all the way back to there. So sure it would be nice if we could put a stitch in here and save this a bit. Let me take a basket, please. Let me just trim the inner edge. Okay, so we're trying to make some progress here. There's our first stitch, horizontal. We've still got a fair amount of work to do back here, but I just want to show you kind of an interval picture. Okay, so we're just working on the lateral meniscus now. This is just the anterior horn. Yeah, a little bit of a tear here. We just took care of it. And now we'll flex the knee a little bit. Bend, pull straight up on the knee. And that gives us a good look into the lateral compartment. We already had a good look at this, and it's normal in the back. See, that looks good. We'll look at the patellofemoral joint at the top of the screen, and you've got some chondrosis here, but again, not bad. Some of that's just part of the fat pad. We're going to take care of that. Here's our shaver coming in. I just want to be able to show you the cartilage surfaces here. And as you look at the patella at the top of the screen, that looks good. You can see a little bit of chondrosis here in the trochlea. And then let me show you where we ended up on the medial side. We put in 2 implants. We used a combination of a meniscal ball and a fast fix bendable implant to give us this repair. I'm actually happy with the way that looks. I wasn't sure we were going to be able to get it to hold, but it looks actually pretty good. So now there's the meniscal ball, and then the fast fix is back. And so we're going to finish up here in just a minute and get you back to the recovery room shortly. Good luck to you now. We're still going to do the PRP injection, of course. Bye-bye. And actually, let's go ahead and get the PRP injection. I just want to come back up on the video, give you an idea of how we do these PRP injections after repairing the meniscus. You can see the needle coming in. We're going to go into the capsule right about here, and then we'll go into the capsule a little bit over here. We're going to stay away from the sutures, obviously, but I just wanted to show you how we're able to do that with just a simple spinal needle even. And the rest of it will go into the joint. Okay? So good luck to you now. Bye-bye. Okay, pump off. We can get this done for him.